are one of our chief residents for this year. Tell me, and you did the Nukes pathway. Tell me a little bit about what got you into Nukes and how you feel about it.
Yeah, well, what really drew me to nuclear medicine was the physiology, the functional component of it. Something I identified early in the first R1 year. And the great thing about this program is you get exposure as an R1 and then in the subsequent years as well. And if you love nuclear medicine like I do, you can apply to the 60-month pathway, which, Dr. Thomas, why don't you expand on the pathway?
Yeah, so everybody gets a little bit of experience in the Nukes pathway their first 2 years, right? We get to see all of the hospital stuff that we do. You get to see those gastric emptying studies. You get to see these cardiac fusion studies. You get to see these DQ scan studies that we do ourselves, right? And our techs do a lot of that volume. We get about 20 studies per day, so that's a lot of volume for your first 2 years, right? You're getting a lot of that kind of stuff. And then you move on to outpatient work, which is basically PET scans, right? And we do one of the most high volume PET scans. Our technologists take about 300 studies a day that we read with just our staff, right? So that is a lot of volume to deal with, so you get a lot of experience. And now after that experience, after you get that experience the first 2 years, if you choose that's what you like to do, like me and you both did, then you could commit early on after your second year, and we dedicate our fourth year to those students for just fully nuclear medicine. That is our nuclear medicine pathway. And so you basically come out this certified with the ABR, and you come out like nuclear medicine certified.
I think the exciting thing about the PET is not only the volume, but all the new tracers that are coming on the market. You've got FDG, you've got PSMA, dotatate. There's new ones too. There's functional imaging of the brain that we see from time to time, sarcoid of the heart imaging. So there's a lot of exciting growth, I think, in the field, specifically amongst PET. And I think that's a very exciting thing about the pathways. You get that exposure a little bit early on, and then a lot at the end to that forward.